Okay, picture this. The hospital emergency room. It's one of those places where every single second counts. And in that crazy high-pressure environment, a new study just put AI to the ultimate test on a really critical job. So, could a machine actually help save precious time when it matters most? Well, let's dive in and find out.
So think about it. In a packed ER, doctors are rushing, patients are waiting. What's a hidden source of delay that you probably wouldn't even think of? It's not the number of beds, it's not even the number of doctors. No, it's something way more technical.
And the answer, believe it or not, comes down to this range, between 3.5 and 6.2%. That is the slice of a highly trained radiologist's time that gets eaten up by one single, repetitive, but absolutely crucial task. Now, that might not sound like a huge number, but in an ER, every single one of those minutes is critical.
That task, it's called protocoling. And the best way to think about it is like this. A doctor orders an MRI for, say, a severe headache. But that's just the name of the dish. The radiologist is the one who has to write the super specific recipe for the MRI technologist. Detailing the exact angles, the sequences, all the settings needed to figure out what's causing that headache.
Now, this recipe writing becomes this constant source of interruptions for radiologists, constantly pulling them away from what they should be doing, interpreting the scans. And you know what happens when people get rushed and interrupted, right? Especially less experienced residents who often get this job. Well, errors can happen.
And here's the thing, this problem is only getting bigger. I mean, at the very hospital where this study happened, the demand for emergency brain MRIs almost doubled in just 5 years. More scans means more protocoling, which means more interruptions and an even bigger bottleneck causing very real delays. So that brings us to a potential solution. A team over in Finland at the Hospital District of Southwest Finland decided to run this absolutely fascinating experiment to see if AI could step in and solve this very problem. They asked a pretty simple question, really. Could an AI read the free text clinical notes that a doctor writes up? The patient's symptoms, their history, all that stuff, and then automatically pick the right complex MRI protocol. Basically, could a machine do the recipe writing? And to find out, they didn't go easy on it. They didn't use some clean, simple data set. Nope. They took nearly 2,000 actual real-world emergency brain MRI referrals straight from their hospital. This is data from the front lines, meaning the AI had to learn how real doctors actually write and think. So they gave the AI 2 specific jobs to do. First, it had to look at the notes and choose the right scan protocol from 12 different options, things like stroke or tumor. And second, it had to decide if the patient needed what's called a contrast agent. That's a special dye they inject to make certain tissues pop on the scan. All right, so they designed the test, they fed the AI all of that messy real-world data. So how did it do? Let's get to the results. And it wasn't just one AI in the ring. They actually pitted several different types against each other. You had your traditional machine learning models, the kind that are great at finding patterns, going head-to-head with modern language models, including BERT, and, of course, the one you've definitely heard of, GPT-3.5. For that first really complex task, picking exactly the right MRI recipe from those 12 choices, one AI just completely smoked the competition. It was GPT 3.5, with an accuracy of 84%. Let that sink in. That means more than 8 out of 10 times, just by reading the doctor's notes, it chose the exact same MRI setup that a whole panel of senior brain scan experts had agreed was the right one. Okay, that's already super impressive. But what about the second job? That simpler yes or no question about using a contrast agent. Well, here the performance was even more striking. A whopping 91% accuracy. For an automated system just reading messy, real-world clinical notes, that is a remarkably high level of performance. It was clear. The modern language model was absolutely the best tool for the job. But, of course, that raises the biggest question of all, right? We know the AI beat the other AIs. But how does it perform when you stack it up against the very people it's designed to help? How does it compare to an experienced human doctor? So to put these numbers into real perspective, the researchers had 2 experienced emergency radiologists, the exact kind of doctors who do this job day in and day out, perform the very same task on the very same set of patient notes. And the result is, well, it's pretty jaw-dropping. For picking the scan protocol, GPT 3.5 scored 84%, right in between the 2 human radiologists who scored 80% and 83%. And for the contrast agent decision, GPT scored 91%, which is basically a tie with the humans.
The AI was performing at the exact same level as experienced professionals.
I mean, you don't have to take my word for it. The study's authors didn't mince words at all. Their own conclusion says it all. The AI's performance was, quote, on the same level as that of the non-neuroradiologists.
So, what does this all mean for the future of, say, your MRI? Is a robot about to start scheduling your next scan? Let's unpack the implications here. The potential is obviously huge. An AI could free up senior radiologists from all those interruptions, letting them focus on complex diagnoses. It could act like a safety net for junior residents just learning the ropes. But, and there's always a but, there's a major hurdle. The study is quick to point out that using a cloud-based tool like GPT with sensitive patient data raises some pretty significant privacy concerns.
And this really gets to the heart of it. The goal here isn't to replace doctors. It's about building a powerful assistant. Think of it like an AI co-pilot that handles the routine stuff, reduces errors, and lets the human experts focus on what they do best, actually taking care of patients.
So I'll just leave you with this thought. We started with a hidden bottleneck in the emergency room, and we've ended up with a technology that performs on par with human experts at fixing it. The question really isn't if AI can do this job anymore, but when and how we're going to integrate it. It kind of makes you wonder, doesn't it? The next time you need a scan, could an AI be the one quietly and efficiently setting it all up behind the scenes?